Welcome to the Sisterhood of Sweat. I am here today with Dr. Josh Levitt. With us today is Dr. Josh Levitt, a naturopathic physician who checks all the boxes that you could ever want in a doctor: education, knowledge, experience, professionalism, kindness, charisma, open-mindedness, and he's a cool guy too. Dr. Josh has a degree in physiology from UCLA, a doctorate in naturopathic medicine from Bastyr University, residency training in integrative medicine, over 10 years of precepting medical residents from the Yale School of Medicine, over 20 years of direct clinical experience, and he's the co-founder and medical director at Up Wellness. He brings a wealth of knowledge. You are going to love this show today. Today, we talked about natural treatment for painful joints, arthritis, inflammation, back pain, sciatica, herbal anti-inflammation, turmeric, boswellia, bromelain, quercetin, etc., unnecessary surgery and drugs. This is massively a common and controversial problem. SURF protocol for pain relief, stretching exercises, unlocking techniques, resistance training, functional movements, and last but not least, down to earth eating, anti-inflammatory diet and lifestyle. It was such a great podcast. Dr. Josh is so knowledgeable on this topic and all the topics that I mentioned above. So make sure to dive into this episode to learn so much about natural medicine, natural treatments, natural pain relief today. Without further ado, we're going to dive in with Dr. Josh. I'm excited to welcome Dr. Joshua Levitt to the Sisterhood of Sweat today.
It's good to be here. Thank you. This is going to be fun.
Oh, you're going to be talking about some of my favorite topics and subjects. I love natural medicine. I'm all about it. I don't believe in sick care. I believe in well care, like taking care of your wellness so that you can avoid having to spend your life at the doctors and the hospital, which is a lot more costly than just doing the prevention right ahead of time. And I want to just kind of almost start diving into something that a lot of the people that come to my gym complain about. Since I have you on the line, they have joint pain. I mean, they have knee pain, joint pain,
back pain,
hip pain, tendonitis. And what are some like natural type things? I mean, what kind of cures can you dive into today to help them out?
Yeah, I mean, that's kind of my area of expertise, and we are definitely on the same page, right? Nobody wants an appointment book full of doctor's appointments. That's for sure. The outcome of those appointments is usually a prescription or a follow-up appointment for an injection or an MRI or something like that. And then in the worst case scenario, it's a surgery. So, I mean, yeah, there's a lot to unpack in your question there, right? You asked about natural remedies, natural cures, natural solutions, whatever you want to call it, for musculoskeletal pain. I'm going to, with respectfully, dial it back or just backpedal a little bit and just sort of say, like, we have to look at what's actually wrong, right? When someone's in pain and that pain is limiting their ability to do something important, like, we both care a lot about fitness. I think we could agree that like fitness is medicine, or movement is medicine. And it's one of the things that's going to keep you out of those doctor's appointments, right? It's one of the many things, including diet and other stuff too, of course. But when a person has bad back pain or knee pain or hip pain, any of these things you mentioned, it can impair their ability to do the fitness, right? So, and that pain is very misunderstood is the way that I would like start this conversation, because so many people who have pain, they wind up in a doctor's office And then they wind up with some kind of imaging study, like an X-ray, MRI, CAT scan, whatever the case may be, whatever is appropriate. And then when they get the results of that image, they find out usually some terrible news, like they have arthritis, or they have degenerative disc disease, or they have a bulging disc in their back. How many times have you heard that? Or their neck? It happens all the time. Or they have a torn meniscus that they didn't know about in their knee, something
Oh,
like that, right? This
okay.
sort of thing we hear all the time. And then,
Mhm.
and this is a crazy thing to say, and a lot of people, it almost sounds fantastical when I say it, but what we see on those images, like that bulging disc or that meniscus tear, are classic examples, do not correlate with pain. And what that means is that, like, there's lots of people who have bulging discs who have no pain. There's lots of people who have meniscus tears who have no pain. And then all of a sudden, when somebody has pain and they find out they have a meniscus tear, we do this thing in our minds and we're like, oh, you have pain, you have a meniscus tear. They must be related to each other, right? But very often they are not. And there's other factors that are leading to the knee hurting more than just the meniscus tear. Or there's other factors that are leading to the back hurting or the sciatic nerve sending those electrical signals more than just what we see on those images, right? Does that make sense?
Yeah, 100%. I mean, coming from my perspective, working with women since I was 21, and now I'm 60,
Yeah,
I have seen everything on the spectrum at all ages, and worked with many, physical therapists. Like I would be at a gym and we would have an in-house physical therapy department, and they would send me their patients. And so
sure,
over time of doing that, you really learn the knee pain wasn't from the knee, it was from the hip pain, or it was
sure.
you were misaligned, you're
Yeah,
out of alignment, or you have muscles that are too tight or too weak, or like
yeah,
there's so many variables.
yep,
But uh that's why I just kind of look at people as it's like this whole entity versus they may be focused on their back hurts. Maybe their core isn't strong. Maybe they're
sure.
lifting from their back instead of their
Yeah.
legs, right?
Yeah, you get it. Absolutely. And like, so I think now that we've established this, right, that like just because you have pain and you have some diagnosis, right, whether it's arthritis or a disc or a meniscus or whatever the case may be, that doesn't mean that you are destined to a life of pain. That doesn't mean that you're destined to have your knee replaced or have surgery or have an injection or something like that. It should be a signal for us medical types to sort of like look a little closer, right? Like, why is there actually pain? Knowing that there's lots of people who have those same types of problems who don't have any pain. And so I think the answer to your question about what are the solutions to these things, really the answer is derived from what are actually causing these things. And you mentioned a bunch of them, right? So there's structural abnormalities. You mentioned a few, like maybe if your hip is out of whack, that could affect your knee. Or similarly, if your foot is out of whack, that could also affect your knee or your hip or your back, right? So structural problems, biomechanical problems are one area. Another one that's really, really common, and you hear a lot about it, is excessive inflammation, right? More inflammation than there should be
Mm-hmm.
based on whatever the problem is.
Yeah.
And this is a huge problem in our society, not just in musculoskeletal pain, but in everything, right? Inflammation is a necessary thing. It's a biological process. We need it to heal and recover from infection or injury. But if there's too much inflammation, we have all kinds of problems, and it creates more pain. It creates the conditions, the underlying conditions for virtually every chronic disease that there is. So excessive inflammation is something that needs to be controlled in many of these cases as well. And we could talk about the specifics of that. And then muscle tension. That's another one where like there's certain muscles in or around the painful area, low back muscles, core muscles, hip muscles, gluteals, quadriceps, hamstrings, calf muscles that might be excessively tight or preferentially tight, right? Like a strength versus flexibility ratio imbalance. And that problem can put extra pressure and forces on a joint, any joint, and make it hurt. And by the way, you can't see inflammation on an MRI, and you can't see muscle tension on an MRI either. So those two things are big ones. And then the last one, which is interesting, a lot of people don't know about it too much, is called fibrosis. And what fibrosis is scar tissue formation that can be microscopic or macroscopic on a large scale, especially if you had a big injury or a big surgery or something in the past. And fibrosis can limit range of motion, can limit blood supply, can compress or impact nerve flow in the muscles, in the fascia, in and around tendons. And so that combination of like structural abnormalities, inflammation, muscle tension, and fibrosis, those things lead to pain. And when you correct those things, and again, we'll talk about that now in a minute, you often correct the pain, even if there is a lumbar disc herniation or a meniscus tear. So that's the way that I approach musculoskeletal pain.
And I mean, I do believe God made our bodies to heal, themselves, and
Yeah.
especially with some care and some help. And I had 3 horrific injuries as a fitness competitor that I'm happy to say I really am like still like sort of in shock, but I performed my fitness routine this week for the first time since I had all of these injuries. And I'm amazed, and I didn't hurt anywhere, and I was able to do it, and I was amazed. But some of the things that I've been doing are taking things like, well, it has Chinese skull cap and it's called arthrobend, but it has a bunch of ingredients to lessen inflammation.
Mm-hmm.
And I take something else called arthrosoothe, and it has, the hyaluronic acid, the collagen, all of the things. And I've also been doing some creatine, because I thought, my body was breaking down. How can I build it up
Sure.
versus what was going on? So what are some of the things when people's bodies are breaking down and they're experiencing pain? What are some of the things you would recommend? Like when somebody, like, I think what I personally am going to just say, I think I probably had tendonitis because I ripped my hamstring from the bone. I ripped my groin from the bone. I think it makes sense when I sit and think about the whole gamut of how much I was running. So when, like a tendon, somebody like, they have a muscle tear, maybe their tendons are too tight and their ligaments are loose, or what kind of stuff do you recommend to people so that they can heal?
Yeah. And I'm with you. I'm on the same page. Our bodies are really good at healing, right? They really are, as long as they have what they need, right? Like there's certain things that are necessary for that, certain nutritional things, and then certain, biological or, physiologic things like blood flow, that kind of thing. And then also if they're not overwhelmed with toxicity, right? Like if you need to have enough of what you need, and you need to not have too much of things like sugar and toxins and that sort of
Right.
stuff. And when you put those conditions in place, the body can heal beautifully, as yours did, as mine has many times. As a rough and tumble person, I have accumulated my share of injuries as well, fractures, muscle tears, just like you mentioned, all of which have healed really, really nicely because I think I pay attention to what those conditions are. So, there's a bunch of lifestyle. Let's divide this up, right? There's kind of 3 main categories. The first category, I would say, is the diet. I think that's like foundational. And if your diet is comprised largely of minimally processed foods, that's, I think, the key there is the foods that are like around the perimeter of the grocery store, right? The stuff that's in its form that it was in when it was in a farm or a field or a fishery, right? Minimally processed foods, it's hard to go wrong with minimally processed foods. Those tend to be the ones that are the most anti-inflammatory. And then, of course, you're avoiding the ones that are the most pro-inflammatory. So a good, healthy, minimally processed diet, and we can speak in more detail about the specifics there if you want. But the diet is point number 1. And then number 2, I would have to put lifestyle as number 2. And lifestyle includes all kinds of different things, including your mindset, which has a huge impact on the way your body recovers. Also your sleep, your stress management, and then your movement patterns. And when you're injured, your movement patterns might need to be modified, but movement is most definitely medicine, even when a person has pain or injury. So we've got diet.
I totally agree.
Yeah, I mean, it's not even like, it shouldn't be alternative medicine to say something like that. It's just it's just medicine. Um, so you've got diet, you've got lifestyle, and then you mentioned several of them, and I'm well acquainted with the companies and the formulas that you talked about. I also am the medical director and a founder of a nutritional supplement company myself, so I'm well acquainted with that world, and I make a number of different products for a number of different body areas, including musculoskeletal pain. So I'll speak from that experience, because supplements, I think, is bucket number 3, and I think supplements can be immensely useful in both prevention
Mhm.
and recovery from these kinds of problems.
Right.
So for musculoskeletal pain, right? I mentioned those 3 things like inflammation, muscle tension, and fibrosis before. And I think those are such critical underlying factors that I made a product specifically targeting those 3 things. Um, and what I put in there, I'll give you the list of ingredients. Number 1 is curcumin, which is the extract that comes from turmeric, the yellow Indian spice. But turmeric itself, the raw root, only contains about 2% curcumin. Curcumin is the active anti-inflammatory compound. So you can take that turmeric out of the curcumin, take that curcumin out of the turmeric and concentrate it up to 95%. So that's ingredient number 1.
That's in there too.
Yeah, yeah, it's it's a powerful medicine. What can I say? I mean,
Right.
it's a powerful anti-inflammatory, and I use, and I'm a big fan of this particular extract called BCM 95 curcumin. That's the one that I use, and it's a proprietary extract that's just been subject to lots of rigorous clinical trials, and it just works great. So that's ingredient number 1. Number 2 would be boswellia, which is an herb
Oh
that a lot of
gosh, I
people know
love
of.
that. Yeah.
Yeah, it's frankincense, right? It's a resin from a tree, and it also is anti-inflammatory and has some research demonstrating that it can smooth out some of the cracks and pits in the
It
surfaces.
oils up your joints. It feels like it helps
That's
to
right.
create like synovial fluid.
Yeah, I
Like
think
it,
what you're yeah, it feels like like it improves the friction right
yeah,
inside of a joint. And
yeah.
we think that the reason why this happens, and there's some studies about this, is that it seems like it, I don't want to say resurfaces, but it smooths out roughness on the cartilage surface. So it improves the integrity of that cartilage surface. It's supposed to be, cartilage in youth is like hard and shiny and smooth and frictionless. And then as we get older, that changes a little bit and you feel a little bit more grinding in there. And
Right.
Boswellia
Oh yeah,
seems
like
to,
you're rusty.
yeah, like you're rusty. Yeah. And in extreme cases, even like bone on bone, right? And when it's extreme.
Yes.
And Boswellia helps to smooth that out. It certainly helps it feel that way. So that's the number 2 ingredient. I also use quercetin. Quercetin has anti-inflammatory potential against all the chemicals that cause inflammation. I'll spare you the biochemical fancy talk, but it has anti-inflammatory properties, and it's also a powerful antioxidant, oxidation being another component of the inflammatory process. And then magnesium, which I know that you know about. Magnesium is a mineral and it relaxes muscles. It's
Mm-hmm.
very commonly deficient, and it's just as simple as that. Magnesium relaxes muscles. And if your muscles are too tight, that's going to make your joint painful. If you're magnesium deficient, that's more likely. Add some magnesium in there, you're likely to feel a lot better. And then I use bromelain is another ingredient, which is an enzyme from pineapple that breaks up that fibrin. So when you feel that gristle in your joints and your fascia, bromelain helps to break that up. And then I use piperine, which is a black pepper extract, to help absorb all those things better. It just enhances absorption.
Mm-hmm.
So those are the ingredients, like hand selected, that I put in my formula that I find.
Okay.
I mean, we've sold over 200,000 bottles with rave reviews on Amazon and elsewhere. So I'm very confident, after 20 years of working on developing a formula like this, that I have something that really addresses those 3 components that underlie the joint pain very, very well. So it's fun work.
And I love that. And I'll see some of this stuff because I was on the journey to heal. Some of this stuff I found purely by accident. I would Organifi had a product for a while. I think it was called Move or something like that.
Mm-hmm.
And it had the boswellia in it and so many, a bunch of other things that I don't remember off the top of my head, but I remember every time I took it, I felt like I was 20
Mm.
because I didn't feel rusty. My joints felt smooth and fluid. And also, do you say turmeric or turmeric? Because
I
I've
know
had
it's
it
commonly mispronounced, right? People have there's many different ways to pronounce it. There's an R in there, turmeric. So I say turmeric. I say turmeric. That's the way I pronounce it.
because
Yeah.
I've had several doctors say it so many different ways. I was
Yeah.
just like, oh my gosh. When I say it, I'm like, am I saying it right?
Yeah.
So we're
I know
getting
people
education
say
today.
turmeric, people say turmeric. A
Yeah,
lot of people miss that there's an R in there. So I say turmeric. Yeah, with an R.
that's what I've always said. So then
Mhm,
I'm like, okay.
mhm.
But I realized as we were talking, because I was extremely sore last week. And I was like, oh my gosh, like, why am I so? And I was missing my turmeric. It
Mm.
was, I didn't have my supplement that has it in. And this week, I'm like, oh my gosh, that's why I feel so much better this week. So, like, I
You know,
know.
it's funny you mentioned that because, like, I think a lot of people don't realize that supplements, they're more subtle than drugs, right? And so I've seen this so many times in patients too, where they're like, they take some, like, I make a recommendation, for example, and then they come back and see me maybe 6 or 8 weeks later or something, and they'll like say like, I don't know if that helped or not. I'm not really sure. And then then they stop it, right? They're taking a supplement. I wouldn't want to take a supplement if it wasn't doing anything. And so they
Right.
stop it. And then when they stop it, they're like, whoa, I think it was working because, it was a subtle effect that kind of came on slowly over time for some
Yeah.
people. And then when they take that away, they're like, whoa, I didn't remember how bad I used to feel. And I think you're just explaining something just like that. Like, I've been taking turmeric for a long time. I stopped taking it. And then it's like, why are my joints hurting so much? Oh my gosh, I haven't been taking that particular thing. And I see that example a lot happen with nutritional supplements and herbal supplements too.
I completely, when I was working on healing, I was doing shots of turmeric.
Yeah.
I mean, every day. And I mean, I swear by it. It's pretty amazing.
Do you
Um,
like the taste of it?
yeah, I don't mind. Well, the core shot, like, that was amazing because
Yeah.
whatever they mixed it with, but
Yeah.
I don't actually mind. You can cook with it too.
Absolutely.
Um,
We cook with it all the time.
okay. So I don't, I actually like it. And I really found it to be amazing for inflammation, as well as the Chinese skull cap. That is amazing for inflammation too.
Yeah. Yep. Yeah, we have
So
that. That's the Latin name of that plant is Scutellaria bicalensis. That's Chinese skullcap, and it's a great plant. We use it a lot in clinical practice. I put it in a formula, and it's useful for the immune system. It's an immunomodulator. And so I put it in one of the up wellness formulas called Immune 11X, and I think that's an herb that more people need to know about. It's kind of more obscure. It's awesome that you know about that, but that one needs its 15 minutes of fame, you know?
I think so, because I have never used it before, but it was in. I just thought, I'm being preventative. I'm
Yeah.
trying to heal. I was just looking at it from all different angles, and so I if I don't notice a difference from a product, I mean, I usually do like a tissue mineral analysis and a blood test to see what I need. If I don't notice a difference, then I usually don't continue it. Uh, but I pay careful attention. I mean, I pay attention to what I'm putting in my body. I pay attention to how I feel, because your body is like your barometer, don't you think?
Absolutely. I mean, that's where, I think we put a lot of credit, we give a lot of credit to doctors for being diagnosticians and figuring things out. But I think if you listen to your body and then you're able to sort of transmit those messages to your doctor, when I get told that I made an astute diagnosis, right? It's usually because I listened to the patient who was listening to their body, right? That's really what it is. And I would say, yeah, absolutely. I mean, our body, we all, you know yourself better than anyone else, inside and out, and what things are supposed to. And I think we have a huge deficiency in modern medicine right now because patients at doctors' offices are frequently not listened to at all. And a lot of times what we see is, a person's complaining, they have some kind of problem. The doctor runs laboratory tests, and it's the laboratory test, the results on that piece of
Mm-hmm.
paper that get all the attention instead of putting the
Right.
attention to the actual person, you know?
Mhm.
And gosh, can I tell you a story real quick that's
Oh,
about this?
yeah,
I
I
just
love
thought of,
stories.
there was a kid. This was written about in a book I read recently. A little kid who went into a doctor for an ear infection, and the doctor looked in the ear and took care of it, gave him whatever he needed. He got better, and then him and the kid and his mom agreed, you should write a thank you note to the doctor that you're feeling better. So the kid did, and he wrote a thank you note, and he included a picture, and the drawing that he included was of the doctor's visit. Like this, little kid, he draws a picture of the doctor visit. So he sends the thank you note to the doctor. My ear feels better. Thank you very much. And there's this picture of the appointment. And the picture was of the doctor sitting at the desk looking at the computer and the kid sitting on the exam table. Right. And that is what the kid thought of his doctor's appointment. Like when I go to the doctor, it's the doctor looking at the computer and me sitting on the table. And that is like, that should hurt your heart to hear something like that. Like, that's what medicine's become, a doctor looking at a computer instead of looking at a patient. And that's the way that a child sees it. And so, it's true. Right. And I
That
think
is
that's,
100% how it is.
yeah, right, right. It's here's the results of the MRI, here's the results of your laboratory test, and it's like, hey doc, what about me? I'm actually here, the real person. And I think we need to do better healthcare wise, and I think and I hope that naturopathic doctors are part of the solution to that problem.
Now, I kind of want to take you on to a little bit more down the path of natural healing, unnecessary surgery, and drugs, and just kind of thinking like the body can heal, and we don't always necessarily, surgery is not always necessarily better than natural healing because it comes with other issues.
It sure
Um,
does.
and so I don't think people always realize that it might take a little longer to naturally heal, but sometimes that natural healing is actually better.
Yeah,
Uh, Now, with scar tissue, I want to attack that first. Um, so my hamstring, they reattached.
yeah.
Okay. My groin took longer to heal because they wanted to let it heal naturally. Um, do you think that scar tissue can be as strong as, I mean, like, because I'm thinking in my head, I'm like, what is holding me together there?
Yeah, right,
Because
right, right.
it completely, the whole adductor bundle tore from the groin.
Yeah.
Is scar tissue pretty resilient?
So it's a great question, and you've observed this inside of your own body. We all have, really, because our skin, where we can see it more easily, develops scars when we cut it or lacerate or whatever. And scar tissue is different than the tissue it replaces. That's just a fact,
Mm-hmm.
right? It
Yeah.
doesn't have, when you just look at any scar that you have on your skin, and you can see that it's not the same as the skin that it replaced. It's mostly the same, but it's not. The fibers that make it up are different, and then the character of those fibers are different as well. So in the case of a muscle, when you have an injury like that internally, muscle fibers are, generally speaking, oriented in a parallel fashion, right? Like, and that allows them to contract and lengthen and shorten, just the way that muscles do. And when they oops, go ahead. You were on mute for a second. You had a we're Yeah, so we're talking about scar tissue, and we can all see on our skin, when our skin scars, that tissue, the scar tissue that replaced damaged skin, is different than the skin that it replaced. And the same is true inside of muscles as well. Muscle fibers are oriented in like a parallel fashion that allows them to to lengthen and shorten, contract, and release. And when they get injured, the scar tissue that replaces them tends to have a more disorganized pattern, right? It's not as linear, it's not as parallel. And so in the healing process, one of the things that's, and before I get to the healing process, those tissues are also more firm. They don't have the same elasticity, right?
Mm-hmm.
Less elastic collagen fibers and more of the firm type that don't have that same pliability, multi-directional pliability. So
Mm-hmm.
one of the things that's really important when you're healing from a musculoskeletal injury like that, where muscles were damaged is to try to cautiously lengthen them, because scar tissue tends to contract, right?
Okay.
And as it contracts, it shortens the muscle, and that shortening will cause a change in the range of motion. It'll cause a change in the overall length of the muscle, which could cause further impairment. So during the healing process, we want to try to organize that scar tissue that's going to want to bundle and be kind of, disorganized. Try to organize it so that it pulls in a more linear fashion along the route, along the course, along the fibers of the original muscle that was torn. And so and I mentioned before when we were talking about supplements, bromelain, and bromelain is a pineapple derived digestive enzyme. It's fibrinolytic, and what that means is it breaks up fibrin, and fibrin is one of the components of that matrix that scar tissues are made out of. And so if you can break that up and kind of smooth it out and lengthen as you go, you wind up healing in a fashion that's much more similar to the character of the original muscle. But it's not going to be exactly the same, because
Right.
scar tissue is not the same as the original tissue. It's just not.
Right, right. But it can be extremely strong.
Absolutely, it can be extremely strong. In fact, I don't know the numbers, the physics numbers of the tensile strength, but scar tissue is strong, right? It absolutely does a great job of sort of replacing injured tissue, and people can go through remarkable. I say remarkable, not in a good way, hideous injuries and recover complete function. And so, yeah, I mean, our bodies are, it's really truly miraculous what we can recover from. Absolutely.
And so also, like, speaking to unnecessary surgery or piling on the drugs.
Yeah. This is like kind of the follow-up to that conversation about where we've gone astray, right? Like patients aren't being listened to as humans that they are. And then what we do, because there's this like seduction in American medicine, and it's like a seduction with the new and the powerful, right? Like we love like there's something sexy about like the newest surgical technique or the strongest new drug. People love that, and it's I use a metaphor sometimes to describe this. It's like if there's a fly buzzing around in the room, you have a bunch of different options, right? You could like open up the window and see if you could get them out. That would be like a gentle, non-toxic option. Or you could like hit it with a fly swatter or a piece of rolled up magazine or something. Or you could spray like toxic chemicals, or you could like use a flamethrower and just torch the thing, and all the metaphor is, of course, like those are like increasing levels of power, right? And it's easy for us to think like, oh, let's just do surgery, let's just do drugs, let's just do a
Right.
therapeutic
We want a
injection.
quick fix. Yeah.
Yeah, the quick fix, the big powerful gun. And
Mm-hmm.
a lot of times, including in cases where there's a meniscus tear and a bulging disc in the back or neck, those tools aren't necessary. You can get by with the opening the window. And the opening of the window, of course, is modifying your diet, modifying your movement patterns, changing your lifestyle to support healing and recovery, using supplements, the kinds of things that we've talked about, turmeric, boswellia, bromelain, et cetera, magnesium, that can really help to improve and recover. And you'd be surprised that a lot of times you can get the fly out. You can keep your kitchen without torching the whole thing, without, ruining everything, and have a perfectly nice recovery at low cost, very, very safe, and very,
Right.
very effective. And so and it turns out that this isn't just natural medicine talking. There are hundreds of thousands of unnecessary or inappropriate surgeries that are conducted in this country every year. Spinal surgeries, knee surgeries, hip surgeries, even full bone joint replacements. And this is published medical science. Like doctors do surgery frequently that doesn't need to be done. And to me, that's a tragedy.
Well, if you go to a surgeon,
Right. It's like if you ever have a hammer, like what's the saying? If you have a hammer, everything looks like a nail. Right. Exactly.
yeah,
You're right.
yeah. So they're probably think, okay, surgery or not surgery. Like it's kind of
Yeah. And I
It's
don't
kind
want
of
to get any,
interesting.
I also don't want
Not
to get anybody upset here. You know, it's easy to,
no, because you need
it's easy
surgery
for,
sometimes.
absolutely. Like it's easy for people to hear that and say like, oh my gosh, there's all these unnecessary surgeries. This guy's anti-surgery. I'm not anti-surgery.
No.
You needed to have that thing buckled back down to the bone. You know, some
Yeah.
people need their knee replaced. Some people need a new heart valve or whatever the case may be, right? There's many, many surgeries that are perfectly appropriate and amazing and miraculous. There's also a whole bunch that are inappropriate and unnecessary. And that's just the reality, you know?
Right. Right. And I was actually back to functioning really well before I had the surgery, uh, except for I couldn't run super fast. But I could
Yeah.
still run. I could still pretty much, even though it was completely gone, which is
Yeah. Amazing.
bizarre.
I was telling
But
one of my kids the other day how our bodies have a lot of, the word is redundancy built into the system. Like it's amazing how you probably heard like, you know, we have two kidneys, but you can function perfectly well with just like half of one, right? Like, you know, we don't use anywhere near the full capacity of our brains and even our musculoskeletal system. Like
right,
we can function very,
right.
very well, even if stuff is like not quite right. And you proved that point.
Oh my gosh. Well, accidentally proved it. I did a
Yeah.
whole fitness routine with a fully blown hamstring. Because I knew I did something the day before the show. I
Yeah.
didn't realize,
How bad it
even
was.
though I went to the emergency room, they didn't come back with the results because it was late at night. So then I flew to the show and just did cryotherapy every day till the show. And I didn't realize that it was completely ripped from the bone. Or I probably wouldn't have done it because I would have been worried what other damage could I do. But like I literally performed, you can bear I look at two routines and you can barely tell the difference between the injured day and the non-injured
That's
day.
amazing. That's
So like
amazing.
I really attribute that uh to your body, if the majority of it's strong, and then also I definitely had a strong mindset.
Yeah. Yeah. I mean, a strong body and a strong mind can get you out of a lot of trouble.
Yeah, oh my gosh. But I don't highly recommend that anybody does that, but I'm just
Yeah.
saying like it's amazing what your body can do. And yes, I had surgery because I wanted to be able to perform optimally at the best level possible.
Yeah.
I wanted to be able to run again at a quick pace. And
Yeah.
so I think though surgery is not always is the best option. And so I like that you talk about unnecessary surgeries being performed because I totally believe that there are plenty of those going on in the
Yeah.
world.
Yeah. I mean, to me, that shouldn't be alternative medicine, right? Like if you have the option of making some simple, inexpensive, safe changes to your supplement regimen, for example, that can get you out of pain, that to me is a better option than doing an invasive, expensive, potentially dangerous or risky surgery. I mean, it's just that shouldn't. And then if you just think about it as like a hierarchy, like a ladder of therapeutics, like let's start with the basics. Of course, if time allows, if it's not an emergency situation, we start with some simple, safe, inexpensive stuff and work our way up. And yeah, if you ever need your hip replaced, great. It's a blessing that we can get our hips replaced and have access to such a thing. But you don't want your hip replaced if doing some stretches and taking some turmeric would solve the problem, right? So that's the pulpit on which I preach.
Yeah, and I love that you're doing that because I don't feel like everybody does, or they want to put you on all these pain medicines that have, oh my gosh, people get addicted to them. There's
Yeah.
so many side effects. And if we could do something natural that isn't going to have side effects that works, like I'm like, sign me up. So
Yeah, absolutely.
what is this surf protocol that you talk about for pain relief? Just briefly, if you could go over some of the techniques.
Yeah, absolutely. So the word surf, first of all, I'm an old surfer. I'm a surfer. I grew up in
I
Southern
love to
California.
surf. Surfing is
Yeah.
great.
I'm a surfer, so that's it's very convenient that that the word surf is a perfect acronym for this protocol that I developed for musculoskeletal pain. I'll take you through what the letters stand for. So S stands for stretching exercises, and we all know that there's so much that can be gained by stretching your muscles appropriately. So stretches of any body region and the muscles that are adjacent to a painful joint, all the way from the head to the toes. S stands for stretching exercises. U stands for unlocking techniques, and that's like trigger point release techniques. A lot of times there's focal areas within muscles that contract. We call them trigger points, and unlocking those trigger points can release the muscle and thereby decrease the pressure that's on that joint and decrease pain. So trigger points and unlocking them is what the U stands for. R in SERP stands for resistance training. And resistance training is strength, right? It's very clear, especially as we move through the years and get older, that having strong muscles is really important, not just for the way we look, but for the way we feel and for our risk of disease and debility. So R stands for resistance training. That's strengthening exercises. And then F is what's called functional movements. And functional movements are movements that mimic the activities of everyday life. So if you're a tennis player, it might be things that look kind of like an exaggerated swing or an exaggerated sidestep, these kinds of movements. Or if you're having trouble getting up out of a chair, you might do a modified squat on a higher surface. Functional movements is the F, and they are movements that mimic the activities of everyday life. And you can apply that surf algorithm to any body area: neck, shoulder, upper back, elbow, wrist, hand, hip, knee, foot, ankle. And I have developed a whole series of exercises that address each one of those body areas into a whole program that talks about the inflammation, that talks about the fibrosis, the dietary, the lifestyle changes. Yeah, it's a matter that's very close to my heart.
Well, I really like to do a lot of functional training, functional movements, really just kind of the flowing, like I do yoga, but I incorporate a lot of movements that are a lot different, like, than what most yoga practices do, because I'm trying to get people to use like their full range of motion, um, and open up their hips and their knees. And
Yeah.
so I think that that's really important in your fitness routine. It shouldn't just be all go hard, all lifting heavy, all boot camp, all sprinting. Like, you have to have some of this built in to your routine.
Yeah, and I think I totally agree with you, right? Like our fitness regimens, right? Our fitness protocols that we do should be useful to us when we're not in the gym or the yoga studio, right? Like it's not about performing well there. I mean, you go to a gym, you go to a yoga studio. It's not about it's not like I say, it's not about improving your abilities inside the gym. It's about those skills and strength and flexibility and movements that you learn and acquire there being useful to you in everyday life, right? Like that's really what it ought to be about. And that's, I think, where the functional movements and functional training comes in. I mean, what good is it if you're just good at yoga in a yoga studio on a mat, right? What you want to be is like, you want to be able to get out of a chair without back pain or get out of bed without without your hip giving out.
Yeah, and I have learned to stop listening to people when they come in, if they're gonna train with, like, personal train with me,
Yeah.
because I mean, I listen to what they want, I listen to their injuries, I listen. They've learned to stop taking oh, I do this and I do this workout and I lift heavy and I work hard, because as soon as I get people in and I put them through what I think means you're truly fit, they oh my gosh, they discover right away that they aren't doing those things because they feel not truly fit. They feel like, oh my gosh, I can't,
Right.
either reach that range of motion, or I'm not strong enough, even though I've been deadlifting 135 pounds.
Yeah.
When I did it properly, I couldn't even, I had to take the weight down. I had, because it isn't about lifting with your ego. It's about training properly
Right.
for good function, good form, using the muscle. It doesn't take hundreds of pounds to get a good physique and have a functional body. And so I think when people really see what the reality is of like being functional, having a true fitness routine that makes them fit, it's so different from what they may have seen on in a magazine or on TV.
Yeah, you're right. 100%. Yeah, absolutely. What good is it that you can move all those plates in the gym if you can't touch your toes or, or like I say, get out of bed without pain? Absolutely. And yeah, we need to be training for life, not for the yoga studio or the gym. Absolutely.
Yeah.
100% agree.
Oh my gosh. And so
Yeah.
you reminded me when you were talking about surfing, my first surfing, I have this friend, oh gosh, she hates to get her face wet.
Mhm.
And she went whitewater rafting with me, and we were on like a level 5 or 6, and she was not in the front with me, but all of a sudden I saw her in the front and she was in the front, and I was like, what are you doing up here? And she's laughing because she's never seen me afraid before, but like the guide in front popped up out of the boat, flew about 10 feet in the air,
Oh my
and I
goodness.
was like, what kind of heck of rapid was that?
Yeah.
I didn't realize he was doing tricks because he knew when the river did a certain thing, and he just kind of popped up in the
Like a
boat.
trampoline or something.
And
Yeah.
she says, I've never seen you scared before. And she was laughing. And I'm like, what are you doing up here? I thought you didn't like water in your face. And so then when we were surfing, which was the funnest thing, I mean, that to me is heaven. The funnest thing
Yeah.
I think I've ever done is to surf. But she was like, oh my gosh, everything I do with you, I'm getting water in the
My face
face.
wet.
I'm getting
Poor
water.
thing. Yeah, she's got to get over that. I agree. Surfing is like, it's so there's just simplicity, connecting with the ocean, riding the board. The tools are very simple. There's not a whole lot that you need, just your board and your body and a wave. Yeah, there's nothing that juices me up the way that riding waves does.
So great. And
Yeah.
all of the things that we talked about today are important to be able to live a life of quality. And I think you can, do that until, a ripe age of
Yeah, absolutely. I see,
what.
I live right now in Connecticut, and there's not a lot of waves in Connecticut because Long Island blocks the waves. But if you go beyond Long Island up to Rhode Island, that's where there's actually some pretty good waves up there. But it's cold in the wintertime here. And those of us who are brave enough to do it suit up in very thick wetsuits, with just our faces sticking out, and brave the freezing cold to go surfing. And I tell you, there's people out there that are well into their 70s out there in the cold water in Rhode Island, surfing almost every day. As long as there's waves, they're out there. And
I
yeah, it's
love
something
that.
that you can do well into ripe old age. Absolutely. Yeah.
And 70 plus, right? Uh,
Easy.
Now I learned in Miami where it was warm.
Yes, right. I know. It's a lot easier when it's warm, right? It's a lot easier when
Yeah.
it's warm and when it's close. Like if it's waves in your backyard and it's warm weather, hey, no problem.
Yeah.
Here, you got to be a brave soul to get out there in the cold water.
Well, I have so enjoyed this interview. I feel that you were such a wealth of information to help everybody with something very important, pain relief.
Yeah, it's a
Uh,
common thing.
that's a big thing, and learning how to use natural medicine, or at least building their awareness that they could use something natural to help them versus all the side effects that you could possibly get sometimes from using a drug, right?
Absolutely. And people think sometimes, oh, my pain is so bad, it's beyond supplements or herbs. And I would argue with anybody who says that. I've
Mhm.
seen people who are in the most advanced or the most severe conditions do really, really well with supplements. So I think these things are much more powerful tools than most people give them credit for. And so, yeah, I certainly urge people to give them a try. Certainly, it's just a sensible approach before you step up to bigger, more invasive options for sure.
Yes. And I know my mom used a lot of anti-inflammatories, and you have to be careful because sometimes if you don't coat your stomach, like it kind of ate a little bit at the lining,
Yeah. Well,
Um,
non-steroidal anti-inflammatory drugs cause ulcers. There's just no question about it. They're very irritating to the lining of the GI tract. They cause micro ulcerations and sometimes macro ulcerations, and are one of the leading causes of GI bleeding. And so, yeah, these even the over-the-counter stuff, right? That's the non-steroidal anti-inflammatories, Advil, Motrin, those sorts of things are not without risk. They are not without risk.
so that's why this was such an important interview today. I want you guys all to give Dr. Joss a review. Let us know how much you enjoyed him, and where can they reach you on social media and get a hold of your products.
Oh, well, thank you for that. It was a pleasure to be here. There's a few places where people can find me and my stuff. The company, which is named for surfing, actually, or for a surfing phenomenon, is called Up Wellness, and you'll recognize it because there's a logo which is the shape of a wave. So Up Wellness is UP and then the word wellness. Upwellness.com is where all of the products that I've created can be found. And then on social media, yes, I make a lot of video content on Instagram. And on Instagram, I am the little at symbol and then Dr. Josh Levitt, Dr. Josh Levitt on Instagram. And you're welcome to join. I think there's over 65,000 people there, which is kind of a lot of people. That's a whole football stadium's worth that are following along on Instagram. And that's been fun. And then I've also been making a lot of TikToks lately too. So
Oh, that's
that's
awesome.
just at Up Wellness. The name of the company is my TikTok account. And yeah, a few of those, probably just because of the algorithm, have really reached an unbelievable amount of people. That platform is really something else. So yeah, Instagram at Dr. Josh Levitt, TikTok, and upwellness.com. That's where you'll find me.
Well, I love that. And thanks everyone for listening to this episode. Thanks, Dr. Josh. And as always, keep on keeping on, keep surfing those waves. Bye, everybody.